If you are older and you've been around the medical community, you've probably learned there are gerontologists or physicians who have received additional training in the care of older adults. But I've just learned the nursing profession also has a subspecialty that focuses on caring for the elder population. It's called gerontological nursing. Joining me is Sandy Yoakum, President of the Florida Gerontological Nurses Association, to tell me about this field. Welcome, Sandy.
Thank you for having me today.
I want you to tell me, what is this nursing specialization?
Basically, it's a body of knowledge and skills that nurses have learned to really help with understanding the needs of our diverse elders in emotional, physical, psychosocial, and spiritual areas of their life. So geriatric nurses really focus on really caring for the whole elderly population.
How does one become a geriatric nurse?
Well, it is definitely something where you have to be a registered nurse licensed in the state, and then you also have to spend at least 2,000 hours in getting specialized training and education on the geriatrics community and geriatric clinical training. And then once you become certified, you have to, every 3 years, dedicate 30 hours of specific geriatric education continuing.
All right, now once you have your certification, where are you going to work?
Basically, you can find geriatric nurses in hospitals, you can find them in skilled nursing facilities, assisted living communities. You can also find them in home health agencies.
Okay, and is it possible, like in a hospital, to ask for a geriatric nurse?
Unfortunately, according to the Hartford Institute for Geriatric Nurses, we know that over 50% of the population that goes into the hospital are 65 and older, but only 1% of the registered nurses in the country are actually certified in gerontological nursing. So with that low number, well, you can ask, but unfortunately you might not be able to find somebody certified at that point in time.
Well, I know you're president of the Florida group, Florida Association, but now tell me about the national.
National basically started in 1984. It's called National Gerontological Nursing Association. And they basically started because they really felt there was a need to have an association that was really focused on the clinical care of our elderly population, especially as it continues to grow.
Very good. Well, now tell me about some of the projects that you are working on here in Florida and here locally in Central Florida.
Okay. Well, we've been around for 6 years as Florida Gerontological Nursing, and we in that time we've done tons of community outreach, education, and one of the projects that we're very proud to be sponsoring right now by the Winter Park Health Foundation is the Conversation Project in Central Florida. So it's really an outreach program to the community to really help individuals figure out, and their families, their end-of-life wishes. So we really teach and train in regards to the three-step process. We need to, first of all, have them talk about it with their families and other people.
Thus the conversation.
Thus the conversation. We need them to write it down so people understand what their wishes are if they can't say them for themselves. And then we also need them to share it with their family, the healthcare surrogate, and especially their physician.
Now, are there other projects that you are anticipating, other workshops or community events?
We are actually currently doing monthly education, and then we also have, at our website, we have different kinds of educational tools that people can go to. We're looking at possibly putting on another workshop. We just did one in February where we had 140 participants. So we're looking at hopefully by the middle of the year, right after the summer, having another workshop, but nothing's planned yet.
Where can I get more information?
You can go to our website, www.flgeronurse.org.
Very good. Sandy, thank you very much for being with us today and helping us with this new branch of nursing.
Thank you.